Okay, let's see spinal curvatures. As you know, in any healthy person, the spine is not straight. It has those curvatures. To have a healthy curvature is important because deviations can cause problems at many levels, like for instance in the thoracic level, the capacity of the thoracic cage, or also proper locomotion. So other joints at the lower limb or the hip may be affected if you don't have proper curvatures, okay, and that will cause wear and tear of those joints in the knee, the hip, etc. Let's see now those curvatures, how they develop, and the possible abnormalities. Alright, first we have curvatures in a lateral view and in a posterior or frontal view. In a lateral view, we can distinguish 5 curvatures, as you see in the first image, in red and blue. In the cervical region, we have a posteriorly convex curvature between the occiput and the axis, also called C2. So it involves the occiput, the atlas, C1, and the axis, C2. Underneath, we have a curvature between the axis and T2, which is the second thoracic vertebra, and this one has an anterior convexity. Then we have the thoracic curvature that is again convex posteriorly. This is possible because of a greater posterior height of the vertebral bodies between T2 and T12. This section uses to have also a slight lateral curvature. Then we have the anteriorly convex curvature between T12, which is the last thoracic, and the junction of L5 with the sacrum. And finally, the sacrum and the coccyx form an anterior concavity. Okay, but how this mess of curvatures is created, how it develops? Well, the thing is that we must distinguish between primary and secondary curvatures. If you look at the embryo of the image, you will notice that its developing spine is totally concave. You can see it by the blue line. Okay, so any anteriorly concave curvature in an adult is considered primary, meaning that it was there before birth. When a 3 months old baby starts to crawl, he needs to raise his head to see what is ahead, and slowly the secondary cervical curvature is created due to the muscles that hold the head and get stronger. Later on, when the baby begins to stand up and walk, the lumbar secondary curvature develops. A human baby can't walk right away like animals do because acquiring the proper curvature is a slow process. You also know that babies walk like chimps at the beginning because the feet look to the sides. This is because the femur and the tibia need to rotate so the tip of the foot looks forward. But what's the purpose of these curvatures? Well, this is nature engineering. The curvatures allow to dissipate the compression forces to the ligaments that hold together the spine and the pelvis, preventing the vertebra getting smashed. As said before, some light degree of lateral curvature of the thoracic spine is normal, but some people have a greater lateral curvature, which is known as scoliosis, as you see, well, in this strange radiograph of this person. It has a curvature to the right in the thoracic region, and then to compensate, it has a curvature to the left in the lumbar region. Okay, this is very extreme. If scoliosis disappears when the patient bends forward, standing up and bending forward, then it is considered postural and classified as non-structural scoliosis. But if the scoliosis is due to abnormalities of the vertebra or the ribs that make rotate the vertebral bodies towards the convexity, we classify that as structural scoliosis and will not fade away when the patient bends forward. We will see that in the seminar. Just know that scoliosis is more frequent in whites and in female patients. Okay, etiology in pathology means the cause. And in the case of pathologic curvatures, the cause can be congenital, meaning that it was present at birth, or it can be neuromuscular when acquired muscular or neurological problems. This caused that deviation. Also, we have idiopathic, which means that the cause is unknown. Okay, learn these medical terms because you will need them from now on and until the end of your studies. Most frequent scoliosis are idiopathic and they develop during childhood or during the teenagers, where the anatomy of the vertebra is completely normal. Other scoliosis are congenital and are associated to some disorders during pregnancy. And some other times, scoliosis is a clinical manifestation of nervous disorders like in cerebral paralysis or in poliomyelitis that is very uncommon here in Western countries because of the vaccine, but you can still see many cases in Africa, in Asia, but it's fading away. Kyphosis is an abnormal sagittal curvature affecting the thoracic vertebra, and that produces a hump, as you see in this image. This is an extreme kyphosis. Tuberculosis was quite frequent time ago. You didn't live that, but it was very frequent. One of the leading causes of mortality in 1900, for instance. And this is a respiratory infection, but the causing bacteria can reach the blood, because it's very easy to reach the blood from the inside of the lungs, and it may travel through the bloodstream and arrive to the vertebra, weakening their bodies and reducing the anterior height of the vertebra. This happened during the Second World War because of the discovering and the massive use of antibiotics. So diseases like tuberculosis became really rare then. Nowadays, anyway, the infection is picking up. Last, we have lordosis. This is an increased curvature of the lumbar spine, which is more frequent in women, and that causes a deformity in saddle. As you can imagine, any curvature that deviates from a normal architecture of the spine will affect its properties and cause further problems as age increases. For instance, pronounced kyphosis, we saw in the last slide, will reduce the volume of the thoracic cage and that will affect the lungs and especially the heart in the long term. Okay, but how can a man lift 200 kilos without collapsing or without breaking the spine? Well, this is thanks to the internal architecture of the vertebra and the curvatures and ligaments that dissipate the pressure. As you see in the image, the vertebral column can resist up to 400 vertical newtons, which is a lot, and 10 newtons of torsion in any direction. Why any given vertebra does not collapse under this amount of pressure? Okay, let's see what we have inside of those vertebrae. First, we need to know that all bones have an outer thin layer of cortical bone, as you see in the image is depicted in red. But inside we have trabecular bone, which is less dense. This architecture provides high resistance while the bone is still lightweight. But you see in the second image, you see the inside of a vertebra that is cut, and you can see that that kind of net of tiny filaments of bone. Okay, this is the trabecular system, and it is not random, although it looks like, but it is not random. It is oriented in the direction of the main forces that affect the bone. So in the vertebrae, we have three trabecular systems that provide resistance. The primary vertical one resists perpendicular compression forces, okay, like coming in the axis from the head. The secondary oblique provide resistance against torsion, and together with the vertical system also resists bending and shear. And finally, we have the secondary horizontal system that resists tension produced by the powerful lumbar muscles that attach to the transverse processes of the vertebra. If we put all these bone lines together, the result is a net that resists all the different forces that may affect the vertebra. But in elderly patients and postmenopausal women, osteoporosis may develop, and this disease makes the trabecular system to weaken and fade away, starting with the secondary systems. Okay, this is because osteoporosis affects the bone-forming cells. Okay, but it doesn't affect the cells that resorb, destroy the bone. Okay, because the bone is a living system, so constantly it's being changed. So in osteoporosis, the cells that remove bone, they work at their normal pace, but the ones that rebuild the bone, these are affected. Okay, so the result is that we lose bone. All right, so you know that the total height of the spine then is reduced, not only the vertebra that collapse a little because they are not so resistant, but also the intervertebral discs, they are reduced, they are compressed. And this is the reason why all people lose height and tend to bend forward. Okay, so this is all for the introduction of the back. Let's focus next on the bony spine.